All right, I think it's safe to go ahead and get started. I see a few of the folks who asked questions in our Zoom room, and I know that folks are still joining. Okay, yeah, now I see the numbers going up. I want to thank you, Edith and Kate, for your excellent presentation, Title V under construction. This is our live Q&A session. We already have some really great questions, and we'll go through those. And for folks who have additional questions while you listen to responses, please feel free to chat those into our Zoom chat. My name is Atia Chaudhry, and I'm a senior program manager in the Health System Transformation team. I am joined by my amazing colleague, Anna Corona, and we are going to facilitate co-hosts just going through the questions. And I think we should go ahead and get started because we have a really great list of questions. So if everyone is ready, I'm going to start with the first question. Would you be willing to share your RFA and scoring sheets? This is exactly what Kansas is in the process of doing. Our current application is over 20 pages, and I love that you were able to condense it into 2 pages.
Yes, absolutely. Happy to share. We have used, I think we alluded to this in the presentation, have used this for other grant applications within the division itself. So some of our state funded projects, and it doesn't work perfect for every situation. I mean, if you think about a program such as MCV, there is just so much more nuance that has to go in with like very specific applications for specific needs. So I don't want it to be like a one size fits all approach, but it allowed Kate and the team to focus on what was the important things we needed to know, and what was the fluff, and what was burdensome, and what do we really want to focus on to help us make a decision to move forward on with a project. If I could boil it down to some of those kind of major key points, I would say that that's probably it.
And if anyone else is interested in a copy of the RFA and scoring sheets, you can drop your email in the chat. I know Carrie had shared her email, so for others interested in receiving those documents, I can grab all the emails and share those with Eden and Kate afterwards.
Yeah, and I'll just say the attachment that should be available on the conference platform is our RFA, our RFA process, but it only allowed PDF. So if you want to let me know, I want to share the Excel file so you don't have to recreate the wheel for the score sheet and all of that. But happy to share it, of course.
Thank you. Next question. When you talk about other state level funded contractors covering the state, was this just a smaller portion of your Title V funding and legacy programs? Or is it the Indiana Health Department directly that is addressing NPMs, SPMs that are doing a good job of addressing major NPMs and SPMs were also funded? Can you provide a few examples of applicants that were funded in child and adolescent health, sector/type of organization, and project summary?
Yeah, I can take that one. So we had taken our state action plan and looked at all of our NPMs and SPMs, and we have some other internal partners at the Department of Health that sort of tackle some of those ones that we created. So for example, the nutrition and physical activity NPMs, we just grant money to our division of nutrition and physical activity internally, and then they reach out and do their thing with that. So really what you'll see in the application were all of the NPMs and SPMs that aren't covered by someone internal to the Department of Health. And so we just limited to those NPMs and SPMs. As far as some of our work in children and adolescent health, this is the best part, is that back before we redid this program, a lot of our focus was on infant health and maternal health, and we sort of missed that children and adolescent health span. So we were really intentional about creating more NPMs and SPMs in those 2 buckets. And then our grantees which in those categories are mostly new to Title V. Like they brought the best applications. We just did our 6-month all grantee check-in last week. We hosted an all grantee meeting and we highlighted adolescent health because it is Adolescent Health Month after all, and had 3 presentations of 2 of them are, I guess one was a nonprofit and they are working specifically with juvenile justice involved youth and specifically Black males in the community here in central Indiana. We had another group that is more of a community collaborative, and they are working on wrapping their arms around youth and creating a youth advisory council. They have all of their local business partners, schools, jobs all connected together into a big coalition. And then the third one is a privately funded, I guess not private, but they fund counseling in high schools. So we've partnered them with local schools and youth serving organizations, and they're providing licensed mental health counselors in those situations. And so our grantees kind of span the gamut as what type of organization they are, but they're really covering a lot around behavioral and mental health, specifically in that children and adolescent population.
That response. The next question, was there a criteria you provided applications that they share in their pitch presentation sessions?
We created a template PowerPoint for them because you have people like me who are terrible at making PowerPoints. And then you have people like Kate who made the PowerPoint that you are seeing who are excellent at making PowerPoints. And so what we didn't want to have happen is for folks to kind of unintentionally judge a pitch presentation based on their 50-minute long PowerPoint with like typewriter in intros and blinds coming in and like puffs of magic and things, rather just the facts of things that we wanted to include in that pitch presentation. And for the most part, I would say that the pitch presentations did stick in the time limits within a few minutes, and then did address most of the things that we asked them to address. Again, I think there's some lessons learned as we go back and thinking about what we kind of wish we should have asked, including more detailed budget breakdowns, deliberate asks on how they plan to include members of their community into the project design or implementation. Things that, as we do this again, we'll definitely add into that pitch presentation. But yes, we did create a template for them to make sure that they addressed.
Great, that's helpful. And thanks for sharing your lessons learned about the pitch presentations as well. The next question, what type of state financial assistance is provided for the MCH programs?
That's another really good question. And Kate, hop in where I forget here. So MCH, our division is lucky in that we do have some state support for our maternal and child health programming. And so we have some support for evidence-based home visiting. We have some support for other maternal infant health related projects. We have a kind of a general line item for perinatal substance use and tobacco use, and a line item for building a state system through which we refer folks to home visiting. We call it My Healthy Baby. And so we have used those state funds as a complement to our federal funds through our federal block grants. As Kate had mentioned earlier, we had this influx of really amazing child and adolescent health applications. And we were able to fund a lot of those because we flipped some of our programs, like for FEMUR, for example, is one that we have traditionally funded through Title V block grant. We flipped that one into our state funding that's specific for perinatal health. So we were able to kind of put the puzzle pieces of state and federal funding together to kind of figure out what programs are best funded by which source, so we can free up some space on Title V, and then re-obligate state funds with stuff that just kind of better fits with those projects.
Thank you for that response. What is your state Title V staffing structure? Are there supports for each domain? Centralized point of contact for all local grantees? Do the same staff who support grantees also draft content for block grant report and plan?
Yeah, Kelsey, this is a great question, mainly because Indiana has not been immune to turnover and changes in our staffing. And so it's been a little bit of an all hands on deck sort of situation over the past couple of years, which in a way has been great because it has really engaged our staff. A lot of them are in the call right now today to be there as subject matter experts. And so we have myself and then 2 other Title V staff that are sort of the main point of contact for all of our grantees if they need anything, and we're always there as backup. And then we have other staff who are subject matter experts. We have our maternal health team, our adolescent health team, our sort of infant mortality team, our child health team, and they are even someone who's actually in the fatality review and prevention team, who's the safe sleep expert, serve as point of contacts for all of our grantees. And then all of those people, including those other divisions that I mentioned earlier that help us reach any sort of national or state performance measure, like nutrition and physical activity, or our trauma and injury team, or fatality review and prevention team, we all come together and everyone does contribute to writing our block grant every year.
I will add that kind of new for us this year is we've created a kind of a grants operations team, because the same people who are good at writing the narrative for child health or injury prevention are not necessarily the same people that are good at making sure our budgets match and things are on time, and the whole shebang that comes with operating a giant federal block grant. So that's new in MCH this year, and definitely excited to see how that frees up some time and space for those kind of topical area subject matter experts to do cool stuff, and then provides the space for the operations team to take a step back and look at Title V as a whole entity rather than kind of hyper focused in these like specific domains. I don't think there's a right way to do it. I don't think there's a wrong way to do it. I think there's probably better ways to do it. And I think that as Kate and I have been on this team together for, I think Kate, now you're 4 years, just trying to figure out, navigate this as we go. And so it's definitely an interesting adventure.
You mentioned the western part of your state is funding through other funding streams. Is that state funds that you use as your Title V match? The counties funded, was that just Title V, or did it include your matching funds?
Yeah, so the map that you saw in the presentation was just Title V funds. We grant out around, I would say about $2 million every year to those grantees, those 29 grantees. And then we do have other matching funds that we use, those funds that Ida mentioned. We have some state home visiting funds, we have some infant mortality funds, we have some tobacco cessation funds. Those are not included on that map. So if you were to ask us for a map of those other funds, we can share those as well.
The last question, did you allow applications for conference sponsorship, hosting a one-day event, professional development, learning activity? We want to host a Safe Sleep conference. Did you allow supplies? We want to purchase the Safe Sleep booklet, DVD for each birth parent at our hospital. For both of these, as a primary activity, that was all we wanted to do, one and done.
Yeah, I would say for the majority of our grantees, they are able to do activities that might be one and done, but it includes more than just that one thing. I'm thinking of one grantee who asked for a pretty small amount of funding to just buy a curriculum on youth mental health and then implement that in school. So it was sort of a smaller scale project. But we were really flexible. I mean, the whole point in this revamp of the process was we want to make this grant really equitable and accessible to a community statewide. And we want you to tell us what is the most important or what you think is the most impactful thing that your community could use. So for some of our grantees, it's an ongoing process, but one of them specifically is working on a suicide prevention toolkit. And so it's a lot of materials, it's a lot of marketing, it's a lot of advertising, which looks very different than some of our other grantees that are doing more service provider type work, seeing patients, working with them, helping them maybe quit tobacco use or get into early prenatal care or many other things. But we do allow supplies. I mean, this is we want to put the expertise back into the hands of our communities and of our partners. And that's really the intention of assuming goodwill and good intent, and then working alongside them to see how their work is impacting the communities.
We managed to get through all of the questions in the questions tab from the conference platform. So I want to invite our participants to unmute themselves if they have additional questions, or you can chat it into the chat. You probably have time for 1 to 2 more questions. And while you think of your questions, I just want to remind participants that if you are interested in a copy of the RFA and scoring sheets, to please drop your email in the chat.
So this is Carrie Aiken from the Kansas team. Thank you for this. This is like right up our alley where we're going. And so this is great to see what you've already done and things that we could potentially incorporate that you wish you would have done in this year. I guess my question is around that notifying your legacy grantees, like how did that come over? Because we have that historical of, they think of this as guaranteed funds, even though we tell them every year it is a competitive process. There's no guarantee, but it's like they just feel that it should just be their money because they've always gotten it. And so I'm afraid that if we bring this to them, like it's going to like blow things up, and which then may push back onto us where we have the leadership support, but then, you know, they hear from those constituents and legislatures, and that could potentially impact our plan moving forward. How did you get that to go over smoothly?
Communication, and early. I think that even before I started, Kate and the previous Title V coordinator was said to grantees, like, this is the last year we're going to be doing this. 3 months later, hey, as a reminder, this is the last year we're going to be doing this. And during that time, Kate and her team, kudos to them, just went into overdrive for data collection. And we had a specific legacy program that shall remain unnamed that was not performing in the way we wanted it to. And they had their data, but we kept our own data. And it was really eye-opening to compare what we were seeing versus what they were claiming. And so it kind of made an easy choice for us there. I will also say that while Kate and her team did their due diligence of making sure that Title V grantees were aware of this and kind of pushing the pros of this too, right? Like, we're going to have longer term investments in your communities. You guys get to do what you want now. You don't have to continue to be refunded for these things that we're all kind of just doing because of forward momentum. Kate and I also did our due diligence of working up the chain of command involving my boss, the assistant commissioner, and our chief of staff and the commissioner in this as well. And when we laid out the data that we were collecting, the evidence that we provided, needs assessment information, why we were doing what we're doing, we kind of made it so folks couldn't say no. And we prefaced all of this by saying, we know that you're going to get calls from community members about this. Here are some things that, you know, people might ask about, or you could say, or, you know, here's a way in which you could address these questions. So folks kind of across the board felt more comfortable with being able to field these, because no one wants to be put in a situation where they get a call from a health officer saying, we lost our X funding. Why, you know, what are you going to do about it? If they have some points that they've heard before and the whys, I think folks just feel generally more confident in those changes. I don't know, and Kate, hop in here if I'm wrong, that we actually received, or we did, but I don't know that our executive staff or our legislative liaisons or kind of those usual suspects of who hear from the communities, I didn't hear anything that they experienced any sort of pushback.
Yeah, and Carrie, I was the most afraid about that because some of these grantees, they've been around 10 years. And so here comes Kate, like changing it all up. And I thought they're going to just straight up to the state health commissioner and say, get rid of Kate, you know, she's doing something crazy. But it was really important that, like Eden said, we had the data to back it up. And we said, this doesn't mean you can't apply for other funding. This doesn't mean there's not other funding streams for this. Just regularly communicating the why sort of surprisingly prevented us from a lot of a headache down the road. We anticipated just the worst case scenario and had nothing but really positive comments back from even those legacy grantees.
And I will say the other kind of part of this that perhaps we hadn't done such a good job of in previous years was connecting grantees to the broader Title V infrastructure, right? Like people are not just getting money to get money, they're getting money for a reason to meet the state's goals for improving the health and well-being of moms and babies and kids and adolescents. And so reiterating that they're part of a bigger structure of this big intent, I hope is allowing folks to connect federal initiatives to what the state indicates is our biggest issues, to how they, as the experts in their community, are feeding up those initiatives to then feed up to the state, then feed up to the federal government. I think giving folks enough credit to understand that they're part of something bigger and they have a direct impact on improving those broader outcomes gives folks a little bit more buy-in as to, you know, how their legacy program just wasn't cutting it anymore. But that's okay. Let's do something bigger and cooler because you're part of this bigger and cooler program.
Sorry, follow-up question. Do you guys fund local health departments majority, or do you have like private providers?
Our local health department, our public health infrastructure in Indiana is pretty disjointed in that we are local control and our local health departments have varying degrees of capacity to implement things beyond mosquito control and, you know, restaurant inspections. And that's no shade at all. It's just a difference in how the funding is and size and scope of public health practice. So we generally fund community-based organizations with the exception of a few local health departments.
Okay. It's the complete opposite in Kansas. We fund majority local health departments and a few of the community-based. So that's where my fear, I think, is coming from with them being local health departments, and then them thinking initially that they're going to lose their funding, their clients aren't going to be able to get the services that, you know, that impacts, like, ultimately that's not what I want to happen, but like we have to make a change. But thank you.
Thank you. In our remaining 60 seconds, I just want to express our appreciation to Eden and Kate for that excellent broadcast presentation and for joining this live Q&A. And thank you to all of our participants for this really rich and engaging discussion. I know we've all learned a lot, and Kate is on standby, ready to send the materials to you all. So thank you for your interest. So hopefully in a few days, you'll have those materials on hand.
Thanks, everybody. Shout out to Team Indiana. Nice to see you, familiar names. See you guys.